going to do today's briefing just a little bit differently because the situation around the country is really serious, and that's true here in Virginia as well. I want you to know that I do see reasons for optimism ahead, and we're going to talk about that in just a bit. But first, we need to start with some hard realities. The case numbers in Virginia are still better than most of the rest of the country, but they're not good anywhere, even here in Virginia. Case numbers have been rising for weeks. They are now at record high levels. They're higher now than they ever have been during this entire pandemic. Virginia is now seeing 4,000 new COVID-19 cases per day on average. Today, we recorded an additional 54 deaths. We all remember what it was like when things were really bad back in May. Back then, we were seeing about 1,200 cases a day. Now we're seeing almost 4 times as many. The statewide rate of test positivity is at 11%. That's almost doubled in just 1 month. All health regions report a positivity rate over 5%, and hospitalizations have increased statewide by more than 80% in just the last 4 weeks. In many parts of the country, intensive care units are at capacity. There are no more ICU beds. Mercifully, that's not the case in most of Virginia, and that's a good thing. But hospitalizations in the ICU have been rising since early November, and capacity is becoming a problem in Southwest Virginia and could soon become an issue here in Central Virginia. In most Virginia hospitals, the biggest problem right now is staffing. The nurses and doctors are literally exhausted. They've been working around the clock for months. Even worse, many of them are now dealing with COVID at home. They live with someone who gets it or they get it themselves. That takes them out of the work rotation, and it makes the pressure on other workers even worse. So I want to start today by showing you what healthcare workers are experiencing. I'd like to introduce you to Emily. She is a registered nurse. She works at Ballad Health. That's the hospital company that serves Southwest Virginia and East Tennessee. It's my understanding that the sound may not be quite as good in this room, so listen up, but hopefully those of you that are viewing will be able to hear this well. Let's listen to Emily.
Okay, so I guess where to start. We started this fight together. We started staying at home, not going out unnecessarily. As a community, I think that everybody did really well. They fought with us. We were trying to stop the spread of it. Everybody knew how dangerous it was. They supported us. We felt like they were behind us. And now, I guess they're tired of it. I guess people are tired of being alone or in their homes and want to get out and be social again. And we understand the importance of mental health, but the fight is getting out of hand. It's getting worse. It's spreading. I work on the COVID ICU, and I've been down here for about a month now, solid. We're losing more than we're keeping. I put an ungodly amount of people in body bags that I wasn't prepared to do, that I wasn't prepared to give up on a patient, but there was nothing else we could do, and we lost them. There's been days that I have lost 2 patients, did their care and got them moved out to the funeral homes and had to take 2 right back that were equally as sick. I go home, I carry it home, I cry a lot. I cry a lot. This is real, I understand the sacrifice and that it's hard to stay home and it's hard to wear a mask and you feel like you can't breathe. But seeing these people die that can't breathe, like it starts to take a toll on you. And you feel so frustrated that they didn't take it serious, like I can't tell you how many patients that we've had that they contracted it at a ball game or at a family affair of some sort, some birthday parties or dinners, or I've not seen my grandparents in a long time. I sacrifice my time, I give it here, and I don't get to be with them at home or around a Thanksgiving table. I'm giving these patients my all. I've sat with them, I've held their hand as they died because family couldn't be here. And it starts to hurt. And if you could just stop one case by wearing a mask or staying home when you didn't have to go out, it would help us so much. Just one case. If everybody did that for one person, I think we could stop this.
Thank Emily for sharing her experiences with us. And I did want to repeat her last words for those of you that may not have heard them, but they're powerful words. I'd quote, "If you could stop just one case by wearing a mask or staying home when you didn't have to go out, it would help us so much. If everybody did that for one person, I think we could stop this," end of quote.